My name is Emma Morrison. I'm an OR nurse at Girard Medical Center Surgery Department. Surgery is very unique here because not only are we a surgery department, but we also do infusions and injections. So if you may just need a liter of fluids because you don't feel good, you can come to us. You may just need a shot, you can come to us. Or you may need a standard colonoscopy or a upper scope and you'll come to us. Or if you have a bigger surgery like a hernia or gallbladder, we can kind of do it all here. Patients are able to choose to have surgery here. It's an option for them. They don't always realize that, but you can come here and have surgeries done, have procedures, infusions, all those things. I think in this community, with it being a rural hospital, I think it is nice because a lot of other places where you go where you have these tiny hospitals, you don't have the same variety, I don't think. Whereas here we can keep our patients local, especially having an elder population. It's nice that they don't have to drive, an hour and a half to Kansas City or a couple hours to Tulsa or, even Joplin. Sometimes that's a long trip and there's a lot of traffic. So it's nice to have, all these outlying communities, especially with how big Girard is. Not only being like in Girard, but you have an ARMA clinic, a Frontenac clinic, a Cherokee clinic, So I think we kind of reach all areas of Southeast Kansas. So it's kind of nice that we can keep it all locally. I think working in the surgery department has helped me connect with patients because when I'm in there getting them ready or getting them back for procedure and they're anxious, nervous, and you just talk to them, a lot of, people where my family's been here for generations, my husband's family's been here for generations, you can kind of find those common interests and those ties to the community, and it kind of settles their anxiety and their stress levels. And so they know okay, I know these people, they're good people, I know you're gonna take good care of me. I feel like the moment that stands out to me the most was honestly not even while I was working here as a nurse. It was when I was working here as a tech years ago. There's this little old lady, she always came in, she knew me by name, knew where I went to school, who my teachers were, and every time she came in, because she was pretty sick, she remembered me, and it just felt good to okay, I'm gonna go visit with her, I'll be back. Regardless of being in a small community like we are, our hospital is very competent. Our nurses, some of them have been surgery nurses longer than I've been alive, and they've seen a lot of things, done a lot of things. And same with our surgeons. They go through all these years of training, come here and get even additional training with, previous physicians. And I bring my own family here to have surgery. So I feel like we have a really good team, a very knowledgeable team, and most of our teammates are from here as well, so this community is just as important to them as it is me. I love my surgery team. Every single one of us is a team player, and I came here knowing nothing about surgery. I had no experience. I'd done some scopes previously at a job, but I had no experience. And the way they just open arm took me in, put me under their wings, and have really shaped me into the nurse that I am today. I love these people like they're my family because I spend more time with them sometimes than I do my own family, whether it be late nights with doctors or coming in on the weekend when I don't even have to, but I choose to because, I want to be able to serve my community and I don't want them to bypass us. I want us to be, available for them, and I know my teammates kind of feel the same way. We want to keep patients here, close to family, close to friends, and I really love who I work with. They've all just been so good to me since the beginning. My name is Emma Morrison, and I'm rooted in rural.